So I work for Halton 0 to 19 Children's Services since starting my apprenticeship nearly 2 years ago now. It's been a really good balance between work and college in that I've been able to do 4 days a week in the workplace. I've covered loads of different areas and been given loads of different opportunities. I've worked with the immunisations teams in schools, delivering COVID vaccines, baby clinics doing weigh-in and reviews, house visits with health visitors, screening in schools, primary schools, doing vision and hearing screening with children, weighing and measuring in schools, and even went out to the Daresbury Hotel working with asylum seekers, checking on their health and well-being. Lots and lots of different things. And then the 5th day of the week I attended college and completed my healthcare certificate and assignments then on my level 3 diploma. So a good balance really, getting in the workplace and in college. When I started the apprenticeship, there was about 15 of us apprentices that all started together. We had a really fantastic opportunity at the start to all work together and all to train together at the same place. I think that helped us to build up really good relationships with Bridgewater, Leeds, and also as peers all working together. So there was loads of support at the start, and I think we felt like we had lots of training before we got released out to the workplace, which was a really, really good start for us all. I think it all enabled us to be really confident before we started. Once we got out into the workplace, we was then supported by all our line managers really well. We got assigned buddies as well that worked with us and supported us really well in the workplace, and that's just continued all the way through the apprenticeship. In college, again, we were supported right from the start. The tutor came out to us during that training period when we were all together, and she started our learning off with us, doing the care certificate, and made sure we were all supported and felt quite confident before we actually came to college. And then we came into Riverside College once a week, and we're supported there with all our learning and assignments, and knew we had a point of contact there. I also did my maths certificate and was supported by a tutor here to do my maths as well, which was really good. That was a good opportunity to do that, and I've passed that certificate now. So yeah, continual support from work and from college equally. I thought it was a fantastic opportunity for somebody in the 50s to have a nice fresh start and to be given that fabulous opportunity to do something that I really wanted to do. It was a completely different sector for me to come into, because I come from education beforehand, mainly working with adults, but I had worked with families and children. And the opportunity that I was given through Bridgewater, working with the 0 to 19 Children's Services, felt like it was going to be a really good fit for some of my previous skills, and something that I felt really enthusiastic about, again, wanting to support families and children really in their healthcare. So I felt like it was a really good fit and an opportunity that I really wanted to seize really and take up. And it ticked a lot of my needs on what I was looking for. And I've also got a daughter who's just joined the NHS as well, so it was a bit of a family project we both talked about. The role I'm just embarking on now is working with children doing hearing and vision screening mainly. I also do weights and measures for children. I've also been given the opportunity to do some education work, which is part of my background anyway. So that's involving mainly dental health education for children in schools. I've also been put in charge of being an ambassador for infection prevention control around different premises around Halton and with nursing staff. So I'm quite fulfilled really in the role that I'm just taking on, but there is lots of scope for me in the future as well to progress on to other roles. Some of the ones I may be interested in are family and children's practitioner roles, which involve again working very closely with children and families, giving lots of advice out to families. I've also opened to, and I've got the opportunity to become a school nurse, and lots of other opportunities as well in Bridgewater. It's just a case of what areas interest you, and we're always kept informed of different opportunities that are available to us.